We are back with another video. So today we'll be discussing a geography related question which can be asked in ADC exam, and definitely you will have one of these questions because you're giving the Australian Dental Council exam. So they are going to ask you questions related to their own geography. Now, Australia, like you know, has a very strong sun exposure and they have a more intense UV component, unlike the rest of the world. And there are people who are into a lot of sports, and there are sailors, and there are people who like to do a lot of water sports for a long duration of time. So they are basically more exposed to the sun rays. So sun related oral manifestations, sun related certain other diseases that can affect your oral skin can happen. And so you need to know those diseases, as you might encounter one of them which you may not in the rest of the world. So we have one question like that. And before we move on to that question, let us discuss something which is called as actinic cheilitis. Now, actinic cheilitis is a precancerous lesion that forms most commonly on the lower lip. Similar to actinic keratosis, actinic cheilitis can undergo malignant transformation leading to squamous cell carcinoma, and that's why it is very important. See, in Australia, the first point of contact is a general dentist. If even if a patient is wanting an implant or a surgical removal of a third molar or any oral lesion for that matter, the first point of contact is a general dentist, and then the general dentist will arrange a referral to the specialist. So even if the patient knows what they are having and it requires a specialist attention, they still have to come to the general dentist first. So you as a general dentist should be aware of a variety of problems that can exist. You don't have to treat them. You can of course refer them to the specialist, but unless you diagnose it, you wouldn't know to whom you have to refer. And since you're going to a specific country, you should know the problems that exist in those countries, right? So you need to know about this lesion, and there are two, three other lesions which are very common in that area, which we will solve in the subsequent mocks. Or even if I can't reach to that video in the meantime and your exam is coming up, I have given those questions in my mocks. There are 22 mocks at the present, and you can solve them. So yeah, let's go back to this. Squamous cell carcinoma on the lip is 11 times as likely to metastasize compared to SCC found on other parts of the body, which makes it even more dangerous. So, oral cavity in general, any lesion that happens, everybody has to take it seriously. How does an actinic cheilitis looks like? These are the lip pictures. It may look like a normal crustacean. The lip may just appear a little more redder. Uh, so read more about actinic cheilitis. There can be some symptoms. There's burning sensation or the lip is appearing a bit swollen. Those things. So when you're going to see the patient, you may not find an exact lesion, but if you look properly, you might see some changes happening which doesn't look normal. Kind of normal, but not normal, and which should raise your concern if you ask the occupation and the patient says, oh, well, I'm out in the sun for a long time. Immediately your brain should go, okay, then some abnormality, dysplasia is happening, and it's better to refer the patient. You as a general dentist are not allowed to do biopsy. Biopsy is not taught also in general dentistry. Even if you learn it, you as a general dentist should not be doing it. It's always a specialist and oral surgeon who does a proper biopsy, because they know which one to take, punch or incision or excisional, etc. Let them decide for it. You can be the point of contact to refer, and once the treatment is done, the patient comes back to you for regular checkups and you follow up, etc. Okay. So now, after knowing all this, let's go back to the question. So the question here is, Adam, a 30-year-old, came to your clinic for a regular visit. He is a rescuer, does surfing very often. The patient works as a surfer and stays out in the sun for a long time. So you see, stays out in the sun for a long time. and he works as a surfer as well. So basically, his occupation involves a lot of sun exposure. So now that when you read this question, immediately your mind should go, okay, this has to come with something which is related to the sun. Okay. So, what is the cause of redness on the lower left? So, if you see this picture or any similar picture that I showed you in the Google, or if absolutely a new picture for you which you have never seen, but you have seen this question and you know sun is involved somewhere, you pretty much know where you're going on to. Okay. So, actinic cheilitis, lichen planus, erythroplakia, hyperpigmentation. Hyperpigmentation is not a wrong option, honestly. But like I said, you're going to that part of the world where actinic cheilitis is common. So you cannot just dismiss the case as hyperpigmentation, because if you do dismiss the case of hyperpigmentation, it turns out something else, it's going to be a problem, right? So as a benefit of doubt, you have to take in consideration those lesions which are related to the sun, and at least for a safety purpose, refer to the specialist to get a biopsy done. Lichen planus erythroplakia are absolute different kind of lesions which appear mostly on the cheek areas, and they'll have some burning sensation associated with it. They may also appear on the lip, but when I have the option of actinic cheilitis, I'm going to give that as a more priority. If that option is not present, maybe I can think of lichen planus erythroplakia hyperpigmentation. See, none of the options here are wrong. But what is the most probable given the history? Actinic cheilitis. Hyperkeratotic plaque scar tissue, it doesn't look like a scar tissue at the moment. But again, this is exactly not a wrong option either, even if you see a picture like a crustacean on the lower lip. But like I said, the priority goes to actinic cheilitis. So I've given a feedback here. You can read more about it. What is the highest risk complication of that redness? Like we had read in the earlier paragraph, it is squamous cell carcinoma. Highest risk complication they have said. Okay. Now, lichen planus, erythema migrans, melanoma, they can also evaluate from actinic cheilitis. It's not like actinic cheilitis won't lead to these things. But what is the highest risk? Which highest risks means which actually puts the life of the patient in danger. That's a squamous cell carcinoma. What is the most important part of this patient management? So basically how you are going to manage. Biopsy, not a wrong option at all. But are you going to do biopsy? No, you can't. Give miconazole cream. It's not a candida infection. It's not a fungal infection. And even if it is, for that matter, first you have to diagnose it properly. Steroid, not a wrong option. But again, unless you have diagnosed it, you just can't give that just directly. Refer to a specialist as soon as possible. So first you need to be very sure of what the diagnosis is before you prescribe anything. So if I have the option of referring to a specialist, I'm going to choose that option. If that option wasn't there, probably I would have chosen biopsy then. But if I'm having this option, I'm going to refer to the specialist as soon as possible. So again, what other things that you can discuss with the patient? You can tell the patient. So this question can also come as an OSCE question in your ADC part 2. Okay, you'll be shown a picture and you'll be like manage the patient. So what you're going to discuss with the patient, how you're going to break the news. So what you can tell them is potentially this lesion looks like this, which is more common in the Australian population, but we are not sure about it. So we have to refer to the specialist first to know more. Also, it would be nice if the sun exposure is limited, especially in the most intense sun exposed timings, which are between 10 to 2, you know. You can also start protecting yourself while you are in the sun by using a sunblock or using a hat or something. And you can prescribe a moisturizer for the lips so that it's not dry, because if it's dry, it becomes cracked and it's more problematic, as in when the sun is exposed, a dry skin is going to parch more than the moisturized lip. And yeah, and whatever the treatment outcome comes, go with it so as to protect yourself in future, like that. So you can just give a brief summary of what the patient can expect instead of being going to the specialist as a complete blank, because you do see some lesion developing and that's why you are sending the patient. But the patient should also have just a small brief idea, not to scare the patient exactly, But this is how you're going to approach the patient. Okay, so you are going to manage in this way. Now, in this question, if these things that I have mentioned come and the question is the same, how you're going to manage, all these things are also correct. So you have to see which one you're going to give the most priority. You understand? So almost all the ADC questions are like this only. As I've mentioned in one of my videos before, it's like me asking you what is the most correct thing in a sandwich, For me, it's bread, cucumbers, tomatoes, onions, etc. But then which is the most priority thing? Then I'm going to go with bread because without bread, I won't make a sandwich, right? Though my other options are also correct. So don't go this as a right or wrong MCQ. See which is the highest priority. Read the keyword. So here the keyword was most important part. You see, important itself is very, what do you say, particular word, important. It's an important thing, the most important. So they are asking you to focus on the most important, meaning what the other things, options that they are going to provide are also important, but you have to choose the most important. So focus on the adjectives which are given in the questions. They are your keywords and they are the keywords which are going to lead you to clear the exam. Okay. Now we come to 4. He says his lips are very dry and choppy and asks what can be done to prevent it and treat it. What will you apply to prevent this? Acyclovir cream, it's an antiviral cream and he's not having a viral infection, so no. Lanolin cream, zinc cream, also not a bad answer. Water resistant sunblock every 2 hours. I'm more towards it. Highly humectant based cream applied few hours, which is also not a wrong option at all. Now, we know that the major problem is the sun exposure. So any cream which is going to block the sun rays is going to be my first option. Since the patient is a surfer and is a rescuer and has to be in the water, I would like to have a cream which is water resistant, which basically stays on the lips for a longer time. And it's better if he's going to repeat it every 2 hours. So sunblock and water resistance are my keywords here. Lanolin and zinc creams are not a wrong option, and the option E is also not wrong. But if I'm having a more specific answer, I'm going to go with that. So I will go with option D here. Again, I've given the feedback, so please read through that. Another patient presented with a brown discoloration on his lip. What is the provisional diagnosis for the brown lesion? They have asked you provisional diagnosis, okay, not the definite diagnosis. Malignant melanoma, not a wrong option. But do you really want to jump on melanoma at the first instance? Well, I'm going to keep that option on the side as of now. Melanotic nevi. Okay. Melanotic macule and melasma. Now, I can be confused here on melanotic macule and melanocytic nevi. But nevi are basically clusters or various numerous lesions. Nevus is a single lesion. Nevi are multiple lesions. Now, since I am seeing only one lesion out here, I am going to go with the macule. Malignant melanoma is also not a wrong option, but it's a more aggressive one, and I don't want to directly diagnose something so aggressive. Malignant means it's already spread, you understand that? It's not a benign lesion, it's a malignant lesion, we call it. And if I just see one lesion and I haven't seen the other things, or I am not aware if certain things have spread in the body, I would first diagnose this as a melanotic macule. And then I'm going to refer to the specialist and then let them do the biopsy and figure out what is actually the right one. So, as a provisional diagnosis, I won't go exactly to the most severe and aggressive form of any disease. I will take the most lightest one and which matches the description because perhaps it's actually a macule. So that, but at the same time, you will pause now this video. You will go and read malignant melanoma features, then read melanotic nevi features, macule, and melasma. Read all four these things because in your exam, it may happen that any of these options can also be correct if they are going to give a question formulated on that option. they give an option of the melasma as being the right answer, then they'll formulate a question which shows melasma as the right answer. So you should know what you're answering. So read about all these lesions. At least 1 hour of yours should go on revising all these lesions, reading more about red and white lesions, etc. So I hope this video helped. And yeah, I've also given a feedback here. You can pause this video, go to the feedback. So yeah, a long feedback. Read. And I guess now just a month left for the exam, 13th and 14th of March. Happy Valentine's Day again. Love your books, love your subjects, and leave a comment if you like the video. And yeah, it's 12:20 here. I better get ready and get my son from the nursery. Bye bye.